When we start, we want to find the right formulation and dose. For many of my patients, though, I start them with a vape because it usually works within minutes in comparison to oral forms that can take hours to work. A vape is like an e-cigarette. Here you can see an individual vaping. He's going to take a puff or breathe in for 5 seconds and hold his breath for 10 seconds. When you start using a vape, the goal is to determine the number of puffs needed. To get a sense of whether medical marijuana works, try to compare symptoms before and after you take the medicine. To do that, before you use the medicine, take notes. On a scale of 1 to 10, how severe are your symptoms? For example, if you have pain, you might say, it is an 8 out of 10 before taking the medicine. It's sometimes useful to take your puff when your symptoms are more severe. Like if you have nausea that only comes about after a meal, that's the time you would want to use the medicine. Or if you have pain that worsens with a movement like bending down, you might want to bend down a little before rating your pain, and then compare the pain caused by bending down after you use the medicine. After rating your symptoms, take your first puff. Then reevaluate your symptoms in 10 to 15 minutes. If symptoms still continue and there are no side effects, then repeat these steps. Rate, puff, wait, and rate. You can take up to 4 puffs. If your symptoms are controlled by less than that, say 3 puffs, then that will be the number of puffs you continue to use with one small change. Afterwards, once you determine how many puffs you need, you will continue that amount of puffs consecutively, or one after the other, without the 10 to 15 minutes in between puffs. If you notice that any minor side effects develop with more puffs, go back to the number of puffs that did not cause any side effects. Just to review, the first time you are using it, you will space out your puffs to find out how many puffs you need. Up to as many as 4 puffs can be used. But once you figure out how many puffs you need to control your symptoms, you will use that amount consecutively without any space in between puffs. The amount of medicine you get with 1 puff is related to the time you breathe in and the time you hold your breath. When I say 1 puff, I usually mean breathing in for 5 seconds and holding your breath for 10 seconds. If you inhale or hold your breath for less, you will get a lower total dose. That's okay if the puffs are controlling your symptoms, but you might have to adjust it if it's not working to control your symptoms. For example, if you can only inhale for 2.5 seconds instead of 5 seconds, that cuts your dose in half. So you would need to take an extra puff to get the same dose as if you inhaled for 5 seconds. So instead of taking up to 4 puffs, you would take up to 8 puffs. Similarly, if you can only hold your breath for 5 seconds instead of 10, you would also take an extra puff to get the same dose. One little trick is that if you find that your throat is irritated with some of the vaporizing so that it's causing you to cough, you can try using some sucking candies, or you can try drinking some water before or after you use the vaporizer.